What if you could live in a country where you never have to worry about huge medical bills again? For many expats, especially those moving abroad long-term, access to affordable healthcare is one of the biggest priorities. Whether you're a young remote worker, a digital nomad, or a retiree looking for a peaceful life, knowing that you'll be covered when something goes wrong can bring real peace of mind. In this video, we're looking at 10 countries where expats can get free or almost free healthcare. This means countries with public systems that offer low or no-cost medical care to legal residents. We're not talking about short tourist visits here. This list is for people planning to live in these countries, either on a visa, a retirement permit, or through work. Country 1. First up is Spain. Spain offers universal public healthcare through its national system called the Sistema Nacional de Salud. If you're a legal resident and pay into the social security system, you're fully covered by public insurance. But even if you're not paying into social security, Spain has an option for you. It's called the Convenio Especial. For a monthly fee, you can buy into the public healthcare system. This costs about €60 a month if you're under 65 and €157 if you're older. Expats often praise the quality of care here, especially in regions like Valencia and Malaga. Both cities are not only sunny and walkable, but also home to well-equipped hospitals and clinics with English-speaking staff. Spain's healthcare system ranks high globally and has low out-of-pocket costs, especially compared to private insurance in the US. Country 2. Portugal comes next and has a very similar system to Spain. The Serviço Nacional de Saúde gives access to residents, including expats with valid residency permits like the D7 for retirees or remote workers and the newer D8 visa. After registering with local authorities and getting a Portuguese tax number, you can sign up for the public system. Many hospitals and clinics in Lisbon, Porto, and the Algarve provide excellent service, and some doctors speak English. While public healthcare might involve wait times for non-urgent care, many expats choose to mix public and private options. The costs for private care are still much lower than in the US or Canada, and many insurance plans are very affordable. Portugal is also praised for its relaxed lifestyle and easy integration process. Country 3. Mexico is one of the most affordable countries for expats in the Americas. It offers two main public healthcare systems. INSABI is for those not covered by Social Security, and it provides basic services for free. IMSS, on the other hand, is open to foreign residents and offers full medical coverage through a yearly fee. The cost depends on your age, but even for older adults, it usually doesn't go higher than $600 per year. Care is available in almost every region, and cities like Mérida and San Miguel de Allende are popular with expats partly because of the good hospitals and clinics. Some people choose to supplement with private insurance to access shorter wait times or private hospitals, which are still very affordable. Country 4. Thailand is another strong option. While the universal coverage scheme is only for Thai citizens, foreign residents who work in the country are enrolled in the public health system through their employer. If you're not employed, you'll need private insurance, but costs remain much lower than in most Western countries. Many long-term expats also use out-of-pocket payments for simple medical needs, since visits to public or even private clinics can be extremely cheap. Chiang Mai and Bangkok both have hospitals with international standards, and many doctors have trained abroad. Thailand is also popular for medical tourism, which shows just how strong its healthcare infrastructure is. You can get top-quality care for a fraction of the cost you'd pay back home. Country 5. Germany is known for having one of the best healthcare systems in the world. Public health insurance here is called Gesetzliche Krankenversicherung, or GKV. If you're legally employed in Germany, you're required to register and pay into the public system. The cost is usually around 14% of your income, split between you and your employer. This gives you full access to general doctors, specialists, and hospitals. Even self-employed expats and freelancers can often join GKV, depending on their visa type. The coverage is wide and includes mental health, dental care, and prescription medication. In cities like Berlin and Hamburg, there are many clinics and hospitals with English-speaking staff. Appointments might take time to schedule, but the quality of care is very high. Country 6. France is another country where expats can get excellent healthcare. Legal residents are covered through the public system, which is managed by social security offices known as CPAM. After living in France for 3 months, expats can register for Protection Universelle Maladie, or PUMA. This gives you access to the public healthcare system. Once approved, you'll receive a carte vitale, which you'll use whenever you visit a doctor or pick up medication. Costs are low, and most of your expenses are reimbursed directly. Paris, Lyon, and Bordeaux are all cities with well-developed healthcare networks. The system also offers great access to specialists. For those coming from outside the EU, it might take some paperwork and patience to register, but the long-term benefits are worth it. Country 7. Italy has a public healthcare system called the Servizio Sanitario Nazionale. If you are a legal resident, you can register and use the public system. For many expats, this means registering with your local health authority and getting a health card. The cost is usually minimal or income-based. Italy's healthcare system varies a bit by region, but overall, the quality is high. Major cities like Rome, Florence, and Bologna have well-rated hospitals and clinics. Expats report that while the bureaucracy can be frustrating at times, the actual medical care is very good. The SSN covers general care, hospitalization, maternity, and even some dental procedures. Country 8. Costa Rica offers one of the best public healthcare systems in Latin America, known as the Caja Costarricense de Seguro Social, or just La Caja. It covers everything from doctor visits to hospital stays. If you're a legal resident, it's mandatory to join the Caja, and your monthly fee is based on your reported income. Most people pay between 7 and 11% of their income. Once enrolled, you have full access to care without paying at the point of service. Many expats choose to live in places like San Jose or Atenas, where hospitals and clinics are easily accessible. Others live on the coasts, where care is still available, though sometimes with longer travel times. Some residents choose to combine Caja with low-cost private insurance to shorten wait times or access private facilities. Country 9, Uruguay, has a public health system through ASSE, the national provider. Legal residents can register and receive care at public hospitals and clinics. The public system is available for free or for a small monthly payment, depending on income. There's also a private option called Mutualistas, which are private healthcare networks. These often cost around $100 a month and include access to private doctors, hospitals, and specialists. Many expats use both systems. Montevideo and Punta del Este have the most reliable access to care. Overall, Uruguay offers strong coverage and has a reputation for being organized and consistent in healthcare delivery. Country 10. The Czech Republic has a system that offers European-level care at a much lower cost than Western Europe. Health insurance is required for all legal residents. If you're working in the country, you'll be enrolled automatically in the public system. If you're self-employed or on a visa, you'll need to sign up with a Czech insurance provider like VZP. Premiums are affordable and care is high quality. Prague and Brno are especially popular with expats because of their modern hospitals and the availability of English-speaking doctors. Dental and vision are often covered too, depending on your plan. Emergency care is included, and wait times are usually short compared to other countries in the region. Each of these 10 countries has a different process and structure, but what they all have in common is that they offer legal residents real access to affordable healthcare. Whether it's through a fully public system or a mix of public and private options, expats in these countries can feel secure knowing they won't be left out when they need care. Some systems, like those in Spain, France, and Germany, are more developed and can be accessed right after registering with local authorities. Others, like in Mexico or Costa Rica, are more flexible and even allow private enrollment at a low cost. Moving abroad comes with plenty of challenges, but healthcare doesn't have to be one of them. Whether you're looking for great hospitals in a walkable European city or prefer the lower costs and warm climate of Latin America or Southeast Asia, there are real choices available. You just need to pick the one that fits your lifestyle and visa plans. So, which of these countries would you live in? Let me know in the comments below, and don't forget to like and subscribe while you're there.